Okay, good morning, Nur Hafizawati binti Bakar. Today, I want to present about introduction to presentation skill. My topic is mental health. Now, I will explain about definition of mental health. Mental health is defined as a state of well-being in which every individual realizes he or her own rotation, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to her on his community. Reality, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and others. The worst effect of mental health is that in the long term, that disorders can drive a person to commit suicide. The keywords of our problem would be mental health, social medias, and education. Type of mental health. Type of mental health problem. First is depression. Second is eating problems. Depression. Depression is a feeling of low mood that lasts for a long time and affects your everyday life. It can make you feel hopeless, despairing, greatly worthless, and unmotiv- and unmotivated and exhausted. It can affect your self-esteem, sleep, appetite, sex drive, and your physical health. In its mildest forms, depression does not stop you leading a noble life, but it makes everything harder to do and seem less worthwhile. At its most severe, depression can make you feel suicidal and be life-threatening. The second problem is eat problems. Eating problems are not just about food. They can be about difficult things and painful feelings which you may finding hard to face or resolve. Lots of people think that if you have an eating problem, you will be over or underweight, and that being a curtain wave is always associated with a specific eating problems. But this is a myth. Anyone, regardless of age, gender, or weight, can be affected by eating problems. And next, I will explain about difficult feelings and behaviors of mental health. First is panic attack, and second is self-harm. Panic attack. Panic attack are types of fear response. They are an exaggeration of your body's normal response to danger, stress, or excitement. Upholding heartbeat or chest pains, sweating and nausea, that is feeling sick, feeling faint and unable to breathe, shaky lips, and feeling like your legs are turning to jelly, feeling as if you are not connected to your body. Self-harm. Self-harm is when you hurt yourself as a way of dealing with very difficult feelings, painful memories, or overwhelming situation and experience. You may not know why you self-harm, but it can be a means of expressing feelings that you can't put into words or think clearly about. After self-harming, you will feel a short-term sense of realize, but the cause of your distress is unlikely to have gone away. And the causes is childhood abuse, trauma or neglect, social isolation or loneliness, experiencing discriminations and stigma. Fourth is social disadvantage, poverty and debts. Five, bereavements, that is losing someone close to you, severance of long-term stress, having a long-term physical health condition, employment or losing your job, or homelessness or poor housing. So how we can carry on mental health problem? I got two ideas, that is nourish your social life and try peer support. Nourish your social life. Feeling connected to other people is important. It can help you to feel value and confidence about yourself and can give you a different perspective on things. If you can, try to spend more time connecting with friends and families. Even a text or phone call can make a difference. The second thing we can do is try peer support. When you experience a mental health problem, it can feel like no one understands. Peer support brings together people who have had similar experience to support each other. This can offer many benefits such as feeling accepted for who you are. Second is increase self-confidence. Third, meeting new people and using your experience to help others. Fourth, finding out new information and places for support. And last is challenging stigma and discrimination. The conclusion is people with mental health issues are people whose difference should be celebrated, whose contribution to society as people of integrity and perseverance should be appreciated, and whose right to determine the key decisions that shape their own life should always be enabled and paramount. Thank you.